Hey guys, it's Dr. Sean Golden here at Back in Motion. In this video, we're going to be talking about patellar tendonitis. If you're watching this video, it's very likely that you have some knee pain, some patellar tendonitis going on. I've personally had patellar tendonitis for a long time in both knees, and this was years ago, and it wasn't until I went to get proper treatment that it finally went away, but I had it for at least a year and a half at the time. It can be so debilitating when you have patellar tendonitis, and it can prevent you from running, jumping, squatting, pretty much working out your lower body in general. It can be a very sharp stabbing pain, or it can just be a nag that every time you run you're reminded that you have this pain, and it really prevents you from progressing at all. So the way that we really go about treating patellar tendonitis is twofold. One, we have to work on the muscles. Because when the muscles are constantly pulling, when they get tight and they get shortened, then they're constantly pulling on that tendon. And that constant tugging on the tendon will inhibit that tendon from being able to heal. And that'll just keep creating more and more inflammation, and it'll help prevent this problem from going away. Secondly, most people that have had patellar tendonitis have come to the point to understand that no matter how much time they take off, even if it's months, the first day they go back to either running or sprinting or jumping or squatting or anything with the lower body, the pain will come right back. And so time off isn't the answer. And the reason why it's not an answer is because patellar tendonitis really only has inflammation as the main issue the first 2 or 3 weeks. If you've been having this for months, it's not inflammation that you're feeling anymore. It's actually some damage that occurred in that tendon, including degenerative changes. And that damage has to be fixed. It has to be repaired. The tendon has to become functional again. And that happens through proper treatment, proper rehab. And time off isn't going to induce any changes in the tendon. So it's always going to keep coming back. Sure, it'll feel good during the time off, but you're not going to be able to get back to doing the things you want to do or need to do to keep you healthy. So what we do in the office is we work on both the muscle and the tendon. The muscle through active release therapy, pin and stretch, trigger point therapy, and then the tendon through things like Graston therapy, proper rehab exercises, cold laser treatment, and then a good home rehab program that you can do on a few days a week that can really help in conjunction with the office visits to get you back to 100% very quickly. We have a very high success rate. I love treating tendonitis issues on various parts of the body because I dealt with them so much myself that I understand the pain and the frustration that you have if you can't get it to go away or if it doesn't get better. So it's a treatment, it's an area I really like focusing on. And so if you want to just talk about it with us, if you want to learn more, go ahead and leave a comment in the comments below, or go ahead and schedule a visit. Go ahead and call us and schedule. I look forward to seeing you guys soon. Take care.